Want to check physician's orders to make sure they have a physician order for this treatment. You want to wash your hands, gather equipment, make sure it's the correct medication, dosage, check for the expiration date, make sure you have the correct device. In this case, we're going to use a small volume nebulizer. We can take a mouthpiece and a mask, nebulizer mask, just in case they weren't able to hold it. When you walk into the room, you want to introduce yourself, verify it's the correct patient, let them know what you're doing. In this case, we're doing a small volume nebulizer treatment. Before you do anything, you want to assess the patient. You want to wash your hands, put on the correct PPE, assess the patient. You'll do vital signs, check for SpO2, check for breath sounds. Put the patient in a comfortable position. It's mostly they'll be sitting up. Once you have your equipment here, you'll want to either choose oxygen or medical air. In this case, we'll use oxygen. And then you'll want to put your medication into the little cap here with a minimum of 3 milliliters. You'll want to turn it on to 6 to 8 liters. Then you'll instruct the patient to have a tight seal around the mouthpiece. Throughout the procedure, you'll want to instruct them to breathe normally with occasional slow, deep with inspiratory holds. You'll also want to be monitoring their vitals throughout the procedure. If you assess any adverse reactions, then you'll want to stop treatment. For asthmatic patients, we will have to do a peak flow before and after the procedure. Once you hear a sputter, then the treatment is done, and you can discontinue it. You'll want to encourage the patient to cough. If there's any sputum production, then you'll take a note of that. If it was an aerosol steroid, you want to encourage the patient to rinse out their mouth and spit. You'll reassess the patient for effective treatment. Make sure the patient is in a comfortable position. Say if you want to gather equipment, you'll want to take the excessive water out of the cap and a sink, and then you can wash it with sterile water. Make sure you gas flow dry it, and then put it in a clean and safe container or bag. You'll also want to instruct the patient for disinfectant and for home use device. Once you're done, you'll gather your equipment, throw anything away that needs to be thrown away, wash your hands, chart, let any personnel know.